Hello, my name is Dr. Dewan S. Raja. Today I will discuss about celiac ganglion and celiac plexus. The celiac ganglion and celiac plexus are interconnected structure in the sympathetic nervous system. Celiac ganglion is totally sympathetic, but its ramification, celiac plexus, contains both sympathetic and parasympathetic fiber. The parasympathetic are coming and going through the celiac plexus are the fibers from the anterior and posterior vagal trunks. That is, that goes through the branches of the celiac ganglion along with the postganglionic sympathetic fibers. Location of the celiac ganglion and celiac plexus found near the origin of celiac trunk, anterior to the diaphragm sclera at the T12L1 vertebral level. Structure typically consists of two large ganglia, right celiac ganglia and left celiac ganglia, but variation exists. Sometimes a circle of ganglia around the celiac trunk encircling the celiac trunk will get ganglia. Made up of collection of nerve cell bodies, sympathetic postganglionic neurons. Okay, so this is the celiac ganglia. We get right ganglia, left ganglia, but it may encircle the celiac trunk. This is the celiac trunk, ventral branch of the upper ventral branch of the abdominal aorta. Okay, so it is so celiac ganglion is getting contribution from the greater splanchnic nerve here. I was saying, okay, from this side, also from the other side. Okay, greater splanchnic nerve. And here the vagus nerve, here vagal trunk will be distributed through the ramification of the or branches of the celiac ganglion to the different part of the body, to the upper part of the abdominal viscera. So the plexus contain both sympathetic and parasympathetic fiber, but the ganglion is composed of postganglionic sympathetic neurons. Okay, we got that. Now let's go. Here is the celiac ganglion, the greater splanchnic nerve here. Okay, here also seeing the vagal trunk, anterior posterior vagal trunk, and the greater splanchnic nerve is for the celiac ganglion. Okay. Celiac ganglion acts as a relay station for sympathetic nervous system signals, receives preganglionic sympathetic fiber from the thoracic splanchnic nerve, that is the greater splanchnic nerve coming from the T5, T6, T7, T8, and T9 thoracic sympathetic ganglion. And it is coming from here, from the lateral gray horn of the T5 to T9, sends postganglionic lateral gray horn of the spinal cord, sends postganglionic fibers to various abdominal organs. Okay, like that the stomach, duodenum, liver, pancreas, and spleen. Celiac plexus or solar plexus, that is a common term by the layman, location surrounds the celiac ganglia and extend into the abdomen around the celiac artery. Into the abdomen means abdominal viscera. Structure a dense network of autonomic nerves composed of both sympathetic and parasympathetic fibers through the celiac plexus. Sympathetic input from the celiac ganglia, while parasympathetic input is via the vagus nerve. Function: provide autonomic innervation to most abdominal organs, including stomach, liver, pancreas, kidney, intestine, adrenal gland. So here the celiac plexus is distributed to those organs, but the greater splanchnic nerve is confined to the pancreas Kidney, suprarenal gland getting contribution from the lesser splanchnic gland, like in the other part of the intestine, below the below the second part of the duodenum. Okay, from the superior mesenteric plexus and also from inferior mesenteric plexus, the lower part of the GI tract. Also, it provides autonomic innervation to the adrenal gland, that is the suprarenal gland. So mostly through the suprarenal gland is getting mostly the fiber from the lesser splanchnic gland. Regulates visceral function like digestion, secretion, and blood flow. So we have to know some clinical significance. Celiac ganglion block, that is important to us. Celiac ganglion block is a medical procedure used to manage pain originating in the abdominal organ, especially in case of chronic or cancer-related pain. The goal is to disrupt the pain signal transmitted through the celiac plexus to the central nervous system. Indication: chronic pain condition, chronic pancreatitis, abdominal pain due to gastrointestinal diseases, cancer-related pain, pancreatic cancer, liver cancer, stomach or esophageal cancer. Okay. So these are my reference. Actually, I got the idea and the images I took from the Grant's Atlas of Anatomy, third edition. And that's all about celiac ganglion and celiac plexus. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.